Imagine a virus so deadly that touching sweat or tears could kill you. Now imagine you are the only person standing between that virus and 20 million people. In 2014, one Nigerian doctor did just that. Her name? Dr. Stella Adadevoh. Dr. Stella Adadevoh was a Nigerian physician and endocrinologist, best known for her 21 years of service at First Consultant Medical Center in Lagos. Born in 1956, she came from a family with a legacy of public service and was respected for her medical expertise and ethical leadership. By 2014, she was a leading doctor in Lagos, known for her dedication to patient care and public health. Ebola virus disease is a severe, highly contagious illness that causes fever, vomiting, bleeding, and often leads to death. It spreads through direct contact with bodily fluids of infected individuals or contaminated objects.
Ebola is an especially virulent disease. This is what the virus looks like. When it enters the body, it courses through the bloodstream, hijacking the victim's own cells to reproduce as fast as it can. Then its progeny rampage on, damaging cells and replicating in ever greater numbers. It infects the endothelial cells that line blood vessels, and the patient starts bleeding on the inside.
In July 2014, Patrick Sawyer, a Liberian-American diplomat, flew into Lagos, the largest city in Africa with over 20 million people. He collapsed at the airport and was taken to Dr. Adadevoh's hospital. Despite never having seen Ebola before, Dr. Adadevoh recognized the symptoms and immediately suspected the deadly virus. She made the courageous decision to quarantine Sawyer, even as Liberian officials pressured her to release him so he could attend the conference. She refused, insisting, for the greater public good, he will not be released. With no established protocols or proper protective equipment, she improvised an isolation ward and educated her staff on infection control measures. Her actions triggered a rapid government and public health response, enabling Nigeria to trace all 20 Ebola cases back to Sawyer and contain the outbreak before it could spiral out of control. While Nigeria's outbreak was contained to just 20 cases and 8 deaths, the story was tragically different elsewhere.
The total number of confirmed cases of Ebola virus disease in Nigeria is 19. 15 in Lagos, 4 in Port Harcourt.
In Guinea, there were over 2,500 deaths. In Liberia, there were over 4,800 deaths. In Sierra Leone, there were over 3,900 deaths. Without Dr. Adadevoh's intervention, experts estimate that Nigeria, Africa's most populous country, could have seen tens of thousands of deaths. Given the speed and scale of the outbreak in neighboring countries, Lagos, with its dense population and busy international airport, could have become the epicenter of a global catastrophe.
The most senior doctor who participated in the management of the index patient of Ebola in Lagos passed on yesterday. Dr. Ameya Stella Adadevoh, a senior consultant physician and endocrinologist with First Consultant Medical Center in Obalende, Lagos, had unknowingly contracted the disease in the process of treating the late Patrick Sawyer.
Dr. Adadevoh paid the ultimate price. She contracted Ebola while caring for Sawyer and died on August 19, 2014. Her sacrifice and unwavering commitment to public safety saved countless lives and averted disaster in Nigeria. The World Health Organization declared Nigeria Ebola-free just 3 months later, a feat hailed worldwide as a model for epidemic response.
The World Health Organization has officially declared Nigeria Ebola-free after 6 weeks with no new cases. The benchmark of 42 days is twice the maximum incubation period for the disease.
Her story remains a powerful reminder that one person's courage and ethical leadership can change the course of history. Dr. Adadevoh is celebrated as a national hero and a global symbol of medical bravery.